Hi, guys. Welcome to another episode of the Stylespreneur Podcast. I am your host, Damali Fields, and today we have with us Dr. Gaby Longsworth is a 63-year-old mom, wife, Ph.D. scientist, certified hair practitioner, a biotech pharmaceutical patent attorney, and the owner of Absolutely Everything Curly. Dr. Gaby, come on in the room. How are you?
I'm great. Thanks for having me on the show.
I'm so excited about having you. I feel like there's a lot of information out there surrounding alopecia, surrounding being, a certified hair practitioner that needs to be said, and we need the education. So if you could give us a little bit about your background in the beauty industry, how you got started, how you decided to focus on hair loss, all that good stuff.
Great. Happy to. So I guess, I've had natural hair for a very long time, and I went through the stages of not knowing what to do with curly hair, then just cutting it all off and having like this really little fro for a long time, doing a lot of sports. Then went through this period of chemically straightening, to get rid of all the curls. But over time, you just kind of get tired of that. I mean, at least I got tired of it, and I'm a scientist as well. So I started learning about, the dangers associated with chemicals on the scalp, on the hair. And I went back to the natural way, but I didn't really know what I was doing. So it really crystallized, I would say, over COVID. I know it's kind of like a bad thing, but one of the silver linings of COVID, right? I had a little bit more time on my hands, and I just started really doing a ton of research into hair products and what makes hair grow, and what do you do about hair loss, and how do you take care of naturally curly hair to make it look its best? What products are best for it? What techniques? And from everything I learned, I just got so excited about it because I felt like for the first time in my life, I actually knew how to style my hair, and it would actually last a week, without having to
and not just a day or two.
Exactly. I went through that every morning, re-wetting it all over. I mean, it's just got so old. And so I wanted to share all that knowledge, and that's why I started the blog, Absolutely Everything Curly.
No, I think that's amazing. And I think that's a story of a lot of naturals, where they're trying to figure it out. What products, what technique. And I honestly was natural for years. And then I had a baby and I figured, oh my gosh, I need to simplify my life. And I did the whole relaxer, and I haven't done that since I've done it. So I'm going back to the natural and just having patience. You really have to have the patience and the knowledge for curly hair.
I agree. It's easily to get discouraged because there's just so few people, especially stylists, that are not really trained in curly hair. So you just feel like you have nobody to turn to.
No, that's very true. I can remember being in hair school and having a mentor come to let me straighten her curly hair. And when I tell you, I didn't know what to do. My teachers barely knew what to do. It was a disaster.
Oh my
It was
goodness.
a disaster. And it was one of those things where I ended up pretty much teaching myself after hair school how to take care of natural hair. And your hair looks amazing, by the way.
Oh, thank you so much. Yeah, it's been a work in progress. And now, I went from the dyeing for so many years to the let the silvers come through. And this is almost
perfect.
3 years.
It looks perfect. I absolutely love it. So with hair loss, now I know you've decided to focus on that. Is there a reason why you decided to focus on hair loss?
To be honest, I didn't actually focus on hair loss, but it is a big part, I think, of what a lot of women suffer from. So I wanted to be sure that I was well versed in hair loss and the issues associated with that, and which is why I went ahead and took the course that was offered by the International Association of Trichologists. Which is how I got a certificate. They call it the what is it called? The certified hair practitioner is what it's called. So I'm not actually a 2-year trained trichologist who has to go through, actual seeing patients and all of this stuff. I did more of the theory behind it and got the certificate, but it did give me the knowledge and the sort of some of it I already knew, to be honest, as a PhD scientist. I had already researched a lot of it, but the really nitty-gritty details about supplements for hair loss. What is hair loss? What are the different types of hair loss? How can you prevent it? what are the diseases that can occur, like thyroid
Right.
disease or other things that can contribute to hair loss. So I thought it was really important for me to understand all that so that I could help as many people as possible, especially people going through hair loss.
No, I think that's awesome. And I'm glad that you kind of described the differences between, a hair practitioner, because I feel like a lot of beauty professionals don't know there are other avenues. There are other
Yes.
courses that you can take in order to better yourself, in order to add to the education that you already have.
Yeah, I think that's really an important point, and I hope more people look into it and take the
Mm-hmm.
course, because I think as cosmetologists, as hairstylists, it would be
Mm-hmm.
great if you also had this additional knowledge to help your clients.
I
And
agree.
it's like a 2 to 4 month course.
Okay.
You go through, you get the materials, and then you sit for an exam online, because the headquarters are in Australia, and they watch
Okay.
you. You have like 40 minutes
Mm-hmm.
to answer the questions. It's not an easy exam, but it's so
Okay.
worthwhile to
It
do.
is.
Yeah,
Definitely. I mean, now you have me thinking about it. Like, that would be awesome, to add to your resume and just to have that
it's
knowledge to better, service your clients.
exactly. It's a win-win, honestly. And it's just, I think we both are very passionate about hair, anything
Yes.
related to hair. So anyone who has that same feeling, I think would be excited to take this course, because to learn even more about the structure of hair, the processes, the different
hmm
diseases, hair loss, and all of this stuff, supplements, especially, and nutrients was really
Oh yeah,
important to me.
especially. No, because in hair school, I mean, you learn a little bit about everything. You don't necessarily dive deep into certain things, especially, like you said, there's diseases, there's reasons why people have issues with their hair. But in hair school, it's kind of like you have this whole book of everything that you're putting into one, certification.
That's right. So it's like superficial level, but a
Exactly.
lot of topics, but they don't have time to delve deeply into each of those topics.
Exactly. That's
Yeah.
awesome. So now when you do talk about hair loss, like one of my biggest things, as soon as I see a client that's pregnant, I'm like, oh my gosh, I immediately want to tell them about the alopecia. I immediately want to tell them like there is a big possibility that after you have that baby, your hair is just going to go through a whole transition. So if
That's
you
right.
would share with us just the different stages in life where women may encounter, hair loss or just some issues, with their hair.
That's okay. That's a really good question. So I guess the first one would probably be pregnancy, right? Because
Mm-hmm.
once you go teenager, 20s, you're like, your hair is all wonderful. You can eat
Right.
bad food, nothing happens, and still looks good.
Right. You could dye it a million times, cut
You
it,
can have it a
whatever.
million times. It has like all this potency to it, and you don't have
Right.
any issues whatsoever. But then one thing that happens when you get pregnant, and I've had 2 pregnancies, so I've
hmm
been through this myself. Even though I have
Right.
a lot of hair, I still noticed the issue.
Yeah.
So what happens is, because your body makes more estrogen actually promotes hair growth, and it holds on to hair. So
Okay.
instead of shedding the usual 50 to 100 hairs a day,
hmm
when you're pregnant, you actually shed less hair.
hmm
So your hair becomes like this luscious,
Oh
full,
yeah.
most women, right? You're like, oh
Yeah.
my God, look at my
hmm
hair. Like, it's so thick and whatever.
Right.
It's just because the hair is not shedding as much. So once you
Mm.
have that baby and your hormone levels go down, 3 months or so after,
Oh
all
yeah.
that hair now comes loose.
Yeah.
You're not actually losing excessive hair. It's just the hair that you didn't lose
Gotcha.
now
It
being
finally
gone.
had the chance to.
But you will
Gotcha.
freak out because you got used
Oh
to that
yeah.
luscious head of hair. So you're
Oh
thinking
yeah.
you're losing hair by the clumps.
Oh
It
yeah.
settles itself, 6 months or so, 9 months after you have the baby. It's
Yeah.
back to where it was, the normal density of
Right.
hair it
Yeah, I
was, right?
definitely went through that. I was like, oh my gosh, my hair's so long and thick and beautiful. And yeah, now I'm back to like a bob. I was like, I'm just cut it into a bob.
Exactly. And so then what happens? Okay, you have a few pregnancies perhaps, and
Mhm.
then you start to go through maybe perimenopause. So this is where your estrogen levels normally start to go down.
Mhm.
Um, and some other things happen. Maybe your nutrition is affected. Maybe you start having some sort of thyroid issue.
Mhm.
Maybe your vitamin D levels are low, your iron levels are
Yeah.
low, right? These things can commonly happen to women
Mhm.
as they get older. These can all lead to hair loss. So it's sort of the
Okay.
medical side of things. We haven't even talked about
Right.
the physical side of things yet, right? So it's really crucial that you're aware of it and pay attention to the signals that your body sends,
Okay.
because they're very easy to fix, right? You
Mhm.
can have your iron levels checked, make sure you get your vitamin D. Most people do not have enough
No.
vitamin D because they're all
Yeah,
covered up in the sun, or they're not in the sun at all. And your
exactly.
body makes vitamin D, right, through your skin. So taking a vitamin D supplement, I think, is really
Mhm.
important as you get
Okay.
older. Perhaps also zinc.
Okay.
Um, Making sure your nutrition is optimal.
Mhm.
You're not gonna have, probably most people, they're
Mhm.
not gonna have this gorgeous whatever hair that they want if what you're putting in your body is not
Yep.
good. If you're eating a lot of fried foods, if you're
Mhm.
having, right, if you have a diet high in simple white sugary things, it's gonna affect your body, which in turn is gonna affect your hair, your skin, and your nails.
Okay.
So one little thing to remember is that hair and nails are non-essential to the body, right?
Okay.
You can live just fine without your hair and your nails. So
Mhm.
if you have a nutritional deficiency, you will first see it in nails and hair,
I agree with that.
right? And
Yeah.
so you will know if you notice that, your hair's just not the same, it's falling out, it's thin,
Mhm.
it's whatever, there's some underlying issue that needs to be addressed.
Okay. And I mean, I'm telling my clients that all the time. There's only so much the products can do if you're not taking care of yourself internally. I can put a mask
Exactly.
on it. I can give you everything, a deep condition, and it's going to sit on top of the hair. It's not necessarily going to go deep down inside the root. So that, yeah.
Exactly.
And I'm taking my vitamin D. So I agree with that.
Yes.
Um, so
Right.
when it comes to alopecia now, I know it's pretty much hereditary, but are there any measures that you can take to prevent it, slow it down, manage it? Like, what are some things people can do?
Yeah, and so there are different types of alopecias,
Mm-hmm.
right? Because you got traction alopecia,
Oh, yeah.
which is where you're basically killing
Yeah, the
all the hair
hairline.
follicles along the hairline because of the
Yeah.
the tight
The
protective
tension.
styles, right?
Yeah.
Once you lose them, they're gone. You
Yeah.
can't get those follicles back, so I should go and get new transplants or whatever.
Yeah.
So that's different, right? The mechanical
Mm-hmm.
things that you can do to yourself where you really affect your hair follicles, which also, by the way, includes not treating your scalp right,
Right.
and those types of things, versus the actual genetic alopecias where it's genetic.
Mm-hmm.
It starts with men with that little
Oh,
circle,
yeah.
and then you get the ring, and then,
Yeah.
right, you can't really do a whole lot about that.
Yeah.
And the same with women. Luckily, it's not as common with women. It's more common as they tend to get to menopause, because then they have lower
Mm-hmm.
estrogen levels, and then testosterone may be a little bit higher, and then that could be converted to Ph.D, which then can affect the hair follicles. So
Okay.
currently, there's really, I mean, the best things that you can do are using minoxidil, which is the FDA
Okay.
approved treatment for that type of genetic alopecia. In addition to, of course, the things we talked about, the supplements, the
Mm-hmm.
nutritional, making sure your diet is optimal, making sure you check have your yearly physical, check your
Mm-hmm.
thyroid, check all your other stuff. But other than that, you gotta pretty much use minoxidil.
Gotcha.
And I would say products that contain rosemary. Rosemary has been
Mm.
shown to also be really effective, almost as
Okay.
effective as minoxidil.
Oh, wow. Okay. I
So if
didn't know
you
that.
know, so if you know you have like hair
Mm-hmm.
loss issues, try to find, I would say, deep conditioners. That's my favorite because
Mm-hmm.
it sits on the
Right.
scalp longer, right? Like shampoo is washed off, your conditioner's washed
Exactly.
off. But that deep conditioner, if it has rosemary, for sure that has been shown to help. Peppermint, spearmint.
Mm-hmm.
Some people say biotin. Hey, you might as well throw it in there.
Yeah.
I don't know if that really makes a
Right.
difference, but why not? But
Yeah.
those things will also help for sure.
Okay. No, I
Like
definitely
minoxidil, you
agree.
got to use forever.
Yeah.
Once you start it, you got to use it, keep using it. As soon as you stop, your hair will fall out.
Oh, wow. Yeah. So you definitely have to be committed.
Yep.
So now there's a lot of women that have decided to wear protective styles. You see it all the
Yes.
times, the braids, the wigs, the crochet. And I don't know if they're necessarily thinking about the scalp and underneath those styles. Are there any recommendations you can give for women wanting to take care of what's beneath these protective styles?
Yeah, I think it's really important not to ignore your hair and your scalp under the
Mm-hmm.
protective styles. Just because you have a protective style doesn't mean you can just
No.
ignore all that, right? In fact, you probably have to step it up a little.
Oh,
So,
yep.
right? If it's braids, of course, you're going to hopefully wash your hair regularly, at least once a week. Make sure you use a shampoo that is clarifying with a tip so you can really get
Oh,
in
yeah. Get
between
really
the
in there.
braids, right? Really get on the scalp there and work it in. And dry it properly, etc. And of course, do not get the braids too tight. You cannot
That's
want, like,
important.
right? It's so important. But they look gorgeous, right? All the different
They look
braided
gorgeous,
styles look
but
awesome, but be careful. I cringe when I
yeah.
see little kids with those
Oh
tight
my
braids
gosh, I
because it's
do.
like,
I do.
oh,
Or
you know
even
what's
just a
gonna
tight
happen.
ponytail, and it's
Oh,
just like,
it kills me
yeah,
because that the weight of that
it
ponytail and
does
what
get
you're
heavy.
putting, it's heavy.
Yep. And I'm telling
Um,
people all the time, like, don't sleep in your ponytail. Sleep in like a soft braid or something.
exactly. I put my hair up in a pineapple like
Mm-hmm.
this so that you're not rolling around on it, right?
Exactly.
And use a silk pillowcase.
Please
Please,
use a silk.
people, if anything, just please use a silk
Please,
pillowcase.
right? Yeah. It's the small things and just being consistent with those things.
Exactly. If you're gonna put your hair up, use a silk scrunchie or a puff cuff, something to gently gather it on top of the head.
Mm-hmm.
Nothing too tight. Those tight elastic things. Oh my gosh, this make me cringe also.
No, I agree.
Right. So those
So
are the braid. But what about wigs?
yeah, what about
I love
wigs?
wigs.
I
I
love
think
wigs.
wigs, right? I think wigs are the ultimate protective style
I agree.
because you're not putting any tension typically
No. And then
on
you
the
can
hair.
actually take that on and off and still take care of the scalp.
Exactly. And so it's critical, right? Make sure you wash your hair regularly, use a scalp massager when you can.
Mm-hmm.
Definitely make sure your hair is fully dry before you put a wig on. Do not put a wig on damp hair,
Yeah.
people, please. There are a lot of bacteria and all kinds of things on our hair
Yes.
naturally.
Yes.
So they will just create this wonderful environment for them to flourish. I
Yes.
don't think people realize that, right?
No, I know. And I've seen it all. So I know exactly what you're talking about. And I mean,
I
I've
could
seen
just
people wear their
imagine.
extensions for 6 months. And I'm like, you are not supposed to wear for 6 months.
Oh my gosh, it's so
I've seen
bad.
it's bad. It's terrible.
See, they don't realize the damage
Yeah.
that it can do,
Yep.
right?
Yeah, because that turned into a haircut. That definitely turned into,
Yeah,
yeah, because there was no saving it.
that's right. Because remember, the hairs keep falling out,
Yeah,
whether you like
yep,
it or not. They're collected, right? Those
yep. That
50 per day or whatever, they're collected
right.
in those extensions. So it just makes a giant knot if you
Yep,
don't.
turns into matting. I've seen it.
Exactly.
So I know we talked
Um,
about some products to go towards. Are there any ingredients in these products that we should just stay away from? Because I feel like there are a lot of
um,
hidden ingredients, and we're thinking we're using the best product ever, but we're not looking at the small print.
yeah, I think that is a really good point. I think a lot of inexpensive products have a lot
Mm,
of mineral oil,
okay.
waxes,
Mm,
petrolatum, which really are not good for our hair. It will make your hair look good.
right.
But what it does, right, it puts this thick coating on your hair strands like plastic. And
Mm-hmm.
if you don't get that off, you can't
Yeah.
really effectively moisturize it. It's just going to get drier and drier and brittle and
And you're
break
just
off,
creating a buildup.
creating the buildup. So you have to use a clarifying
Mm-hmm.
shampoo regularly.
Yep. I
But you
love
have to be
clarifying.
careful, right? You have to
Yeah.
be careful.
Because,
If
yeah.
you use sulfated shampoos, there's not necessarily anything wrong with sulfated
Mm-hmm.
shampoos, but they are very strong. So if your hair
Yeah.
is dry and thin, you have to be careful because typically sulfated shampoos are formulated at a high pH, meaning they're basic. A
Mm-hmm.
basic pH will ruffle your cuticle layer. If
Mm-hmm.
you have a ruffled cuticle layer, it's gonna tangle and get caught in
Mm-hmm.
each other and all of that
Oh, yeah.
mess, right? So you have to be careful. So what can you use instead of a sulfated shampoo? My preference is a product with olefin sulfonate.
Okay.
Olefin sulfonate is also a surfactant. It also cleanses like a sulfated shampoo, but it's
Mm-hmm.
formulated at a lower pH. It's active at a lower
Okay.
pH. So, which is the pH of our scalp and our hair. So it's actually much better in terms of the health of your hair to use
Mm-hmm.
something like that, a clarifying shampoo like that, than a
Okay.
sulfated shampoo. So I would stay away from those unless you have straight hair that's
Right.
oily. Use your sulfated shampoo all you want. It's fine. Nothing's going to happen. But if you have natural hair, curly hair, silver hair,
Mm-hmm.
it's gonna get really dry if you use sulfated shampoo, even if you deep condition.
Okay. So
So I would stay
that's
away
really
from
important to
that.
know. Yeah.
It's the
So
same with the
now,
waxes, like I said, and the other ingredients. And
so
water insoluble silicone.
okay. So when these clients are out here searching for hairstylists, would you recommend that they ask the hairstylist, what are you using? Because I've heard some scary, crazy stories where the stylists aren't wanting to share the products that they're using with the
I
clients.
have heard that too,
Right?
unless they sell it. Then they're happy
Yeah,
to share because they want you to buy it. I
exactly.
My biased opinion, I could be totally biased, is that most
Mhm.
hairstylists don't know the ins and outs of ingredients either. They just want to,
Yes,
they know what they know and they're going to push that on you. So some may be knowledgeable, some may not be knowledgeable, and they're going to be
hmm,
selling you something that is actually not good,
I agree.
in
But
my experience.
what I'm seeing behind the chair is thankfully a lot of the clients are doing their research. So they're coming to, which some stylists that may annoy them, but whatever. They're coming to the stylist with their research done, saying, "Hey, I prefer using this product." I've had a few clients, I have an all natural product that I
Wow.
just ran across. Can we
Oh,
use this versus, something in the salon? And I worked in corporate salons where I was almost forced to use certain products. So
yes.
yeah, but so yeah,
Interesting.
yeah, we have to start asking these stylists, like, what are you using?
Exactly. We got to make sure that the stylist knows,
Yeah.
what is good and what is bad,
Which is
you
why I
know.
have you on the podcast today, so we can share this good news so
That's
that we can get our hairstylists doing more research, taking more classes, and just being able to, have more knowledge for them and for their clients.
exactly. And then there's just so much on this topic, right? Because we could talk
Hmm.
about water soluble products
Yeah.
which are lighter weight for the low density, thinner hair types versus the ones
Hmm.
with oils and butters that are heavier, which is what I need to use because I have so
Right.
much hair and it's dry. So knowing the difference between those two will help you figure out what ingredients to
Okay.
use and where it matters. Like shampoo,
Okay.
conditioner, shampoo can be cheap. You don't have to
Hmm.
spend your money on the shampoo.
Right.
Conditioner should be nice and slippery, right? Because it's really restoring the pH, getting rid of the knots and the tangles. Really, where
Hmm.
I would spend my money is on a deep conditioner. Please deep
Okay.
condition people every week, unless you have really oily
Gotcha.
hair. You
Yeah.
got deep condition. And then your leave-ins, your stylers, those is where I would spend my money. Those are the
Okay.
important ones.
Okay, that makes sense. Now, I know that you are a biotech pharmaceutical patent attorney. Now, tell us about that. How did that come about? Was that before or after your journey within hair, or how's that work out with you?
So that was way before. I've been
Okay.
doing patent law for almost 25 years.
Wow, that's
So
awesome.
I know it's amazing how fast the time went. But after I got during my PhD training, I was thinking, wow, maybe I don't want to run a laboratory anymore and be a
Yeah.
professor. Maybe I need to do something else.
Yeah,
And
that's
that's when I
awesome.
went to law school and
Hmm.
became a patent attorney. So, but it's nice because I'm in biotechnology and
Hmm.
pharmaceuticals and vaccines and biologics and all of that stuff. So I'm kind of in that world where
Hmm.
ingredients matter and
Right.
that kind of thing. It's not hair, of course, but
Yeah, but
it's
it kind of complements and it's parallel.
exactly.
So,
That's right. I really enjoy that. It is my full-time job, so it keeps me
okay.
super, super busy. So my hair blog and everything is like my passion
Your
project, my
passion.
hobby.
Hmm.
Every minute I get, every waking moment that I have time left to spend on that, I spend
No,
on that.
that's awesome.
I enjoy
So,
that.
and what made you want to have this passion project? Because I know a lot of people, they have these careers, they only do that, they retire, and then it's just like, you know what? Maybe there's something else I can do.
Yeah, that's such a
And
good
was it
point.
just because of your hair and the journey that you had learning your hair?
It was partially that, but also because I am in a law firm and
Hmm.
it's a professional environment. There are not a lot of people that look like me, number
Hmm.
one,
Yes.
that are partners. Staff, yes, but among the legal staff,
Hmm.
very few people and very few with curly natural hair.
Right.
They all straighten their hair, and certainly nobody leaves their hair undyed. They all
Right.
dye the grays, right? It's just me and a couple other people. The men don't care, but the women, they
Right.
never do it. So I just wanted to have a place where a professional woman would
Hmm.
say to herself, I don't have to do these chemical things anymore that I don't really
Right.
want to do, but I feel like I have no choice because look, there are people that don't do it and they excel in their profession and they're happy. They don't have to put themselves through, exposing themselves really to increased
Right.
risks of cancer, to be honest. If you dye and chemically straighten, unfortunately, it does have an effect. So I felt like that was my other passion, to be a role model, but also show how you can get there.
Right.
It's a transition, right? To go from chemically straightened to natural.
Oh, yeah.
Grow it out. It's a process. It's difficult. It's
Yep.
difficult.
And just accepting the new look and all of those things.
It's
No,
acceptance, and it's
Yeah,
freedom.
I think so. I
It's
definitely agree
freedom.
with that. Being able to be yourself.
Yeah. And maybe because I passed 50 a few years ago, but I was like, that was actually a typo. I think I'm not 63 yet, thank goodness.
Gotcha.
But I'm in my 50s. And once you hit 50, you just don't even care anymore what people think.
Yeah.
Like, this is me, people.
Yeah.
So, take it or leave it.
Right, exactly. So there's one thing I love to ask everybody that's on the podcast, and that is, what's your stylespreneur power, but what's your power as far as being able to reach people, being able to educate people, being able to show people that you can be free, you can be unapologetic. What's your power?
Wow, what's my power? I think maybe my power is that people can sense that I'm genuinely interested in helping, and that I'm unbiased. I'm not sponsored by any brands. I'm science. Like, I give you the scientific reason for why to do something or not do something. And I think people like that. It's a different approach.
Right. No, and I absolutely love that. It's been a pleasure talking with you, and I can see that you are genuine. You love what you do, and that it just comes natural to you.
Oh, thank you.
And it also
Thanks
is
so
something
much.
that, not, you hear biotech or pharmaceutical, and it's just like, oh my gosh, what are they talking about? But I feel like you talked about it to a point of being able to understand it, being able to talk about it, where somebody's like, okay, I can follow this. I know what she's talking about,
Thank you. I love teaching and mentoring. So I try to, explain things at a level anybody can understand, because I think that is what makes a great teacher.
No, and that definitely came across today.
Thank you.
So I thank you so much for being on the show. It's been amazing talking to you. I do believe that after listening to this episode, stylists are going to be like, man, I should go be a hair practitioner. Like, that's something I should definitely look into. So I thank you for sharing with us about that.
Great. I'm happy to. I hope some people do it. It's really fabulous to get the extra knowledge.
I agree. Well, thank you so much for being on today's episode.
Thanks for having me.
Have a good day.
Thank you. You too.